Okay. Classical conditioning. Classical conditioning is based on the idea of learning through temporal association. Make sure you underline or designate temporal association as important. It's based on the idea that when two events repeatedly occur together, they become fused or conditioned together. Classical conditioning was created by, or discovered, I should say, by Pavlov. He was a biologist studying salivation in dogs. What he noticed was that he had dogs in the laboratory. They were in close proximity to one another. And whenever it was time for the dogs to be fed, a bell would be rung. Over time, the dogs essentially learned, if you will, or their bodies responded to the fact that the bell would always precede food. Over time, the mere sound of the bell would pull a response that normally was associated with food. So the bell became a conditioned stimulus for the presentation of food, and food would lead to salivation. So let's go through this together. Okay. There are 5 primary concepts that you need to be familiar with. The first is the unconditioned stimulus. What does unconditioned mean? Hopefully what that means is this response will, or this stimulus, I should say, will pull a response unconditionally. If you hear a very loud noise behind your head, what do? Usually people will jump. If you have something very sour on your tongue, often people will go, and they'll make a funny face. They're not really trying to, it's just a reaction. The sight of a very physically attractive individual might lead to a sense of sexual arousal. These are not things that people consciously choose. They are reactions that are pulled from the organism. That's a very important point that you need to get from this lecture. Classical conditioning deals with responses that are pulled from the organism. Okay, so the unconditioned stimulus, in the case of Pavlov, was food. The unconditioned response, when you present food to a dog, the dog will salivate. I have a video on, as part of this lecture, if you'd like to see my big dog salivate to turkey, you may. That's Teddy and Teddy and the unconditioned stimulus, I think is what I called it. Now the bell, the neutral stimulus, is paired with the unconditioned stimulus over time. So it goes bell, food, salivation, bell, food, salivation, bell, food, salivation. That occurs repeatedly enough that eventually it goes bell. Even if there's no food, salivation will occur. So when that pairing happens, the unconditioned stimulus with the previously neutral stimulus, now the bell is called the conditioned stimulus, and it leads to the conditioned response. So the 5 concepts to be aware of: unconditioned stimulus, abbreviated as UCS, unconditioned response, UCR, NS, neutral stimulus, CS, conditioned stimulus, CR, conditioned response. That's classical conditioning in a nutshell. There is a treatment based on classical conditioning, and that's called systematic desensitization. Systematic desensitization is based on the principle of counter conditioning. Counter conditioning. This is a response that is incompatible with fear. This occurs at the same time as the feared conditioned stimulus. So, counter conditioning. According to systematic desensitization, there are 3 primary steps. First of all, you need to know that systematic desensitization is a behavior therapy approach designed to treat phobias. Phobias, if you've not had advanced psychopathology yet, is an intense, irrational fear. Sometimes people have dog phobias, people have flying phobias, people don't like to stand on the top of buildings. They're afraid that they're going to run and jump off the building. People can have phobias of many different things. But know that a phobia is a very intense negative reaction. Hang on. Up until about 1950, the only form of treatment that was available for phobias was psychoanalysis. Once behavior therapy hit the scene, then there were alternative treatments available. Now, think about it. How do you think a phobia would be conceptualized within psychoanalysis? Let's say I have a snake phobia. In your understanding of psychoanalytic concepts, hopefully you're kind of thinking to yourself, oh, okay, snake phobia. Snake probably represents a phallus or a penis, so anyone who has a snake phobia must be in an Oedipal or an Electra complex. Therefore, the person needs to be in many years of analysis to overcome this symbolic fear of snakes that really represents a fear of castration or fear of not having a penis, penis envy. And once the person realizes that, then the need for the snake phobia will disappear. Well, Volpe, the originator of systematic desensitization, came along and he said, I don't think that's true at all. Basically, people learn phobias through the process of classical conditioning. People associate dogs with fear or needles with pain. And so phobias are learned according to the principles of classical conditioning, and they can be unlearned according to the principles of classical conditioning. So first step, systematic desensitization, have people learn deep muscle relaxation. Once deep muscle relaxation is learned, then you have the person start a fear hierarchy. Why don't you take a moment and think of something that is frightening to you? Tornadoes, injections at the doctor's office, cats. People have a variety of different things that they're frightened of. Okay, so whatever it is, put that down under number 10. Let's say you're afraid of dogs, and the most frightening thing you could think of would be having a pack of dogs standing around you in a circle, growling and spitting and doing all of those dog things. That would be 10. Now, what's something that would be a little less frightening than that? Maybe one dog growling. Then a little less frightening, under 8, maybe a dog running toward you. Under 7, what would be a little less frightening? So basically you want to have a graduated 10 or 12 step list of the most frightening experience at the bottom and the least frightening at the top. Usually the least frightening experience would be let's say you had a dog phobia and you also had a cat. You're fine with cats, but you have to take your cat to the vet. And as you were calling to make a veterinary appointment, you realize that your new vet allows dogs, and so you feel a little frightened. Maybe that would be under number 1. All right, so step 1, learn deep muscle relaxation. Step 2, create your fear hierarchy. Step 3, counter condition, meaning pair item number 1 with deep muscle relaxation. So how that would go, you go see your behavior therapist. Your behavior therapist gets you in a state of deep relaxation and then looks at your list and says, now I want you to think about calling the vet. How relaxed are you now? If before you were fully relaxed, how relaxed are you now? Ooh, I'm a little tense. Okay, just keep breathing. Keep relaxing. Keep relaxing. Keep relaxing. Keep thinking about calling the vet. And as soon as those two things can coexist, a feeling of relaxation and calling the vet, then you move on to item number 2. It is very systematic, as the name of the technique suggests, and it is a process of desensitization. Learning or relearning that calling the vet does not need to lead to panic. So when you think about the fear hierarchy, there are several things you need to remember. Remember the steps, 1, 2, 3. Remember that it's based on classical conditioning, and remember that it utilizes the concept of counter conditioning. Finally, aversion therapy is a form of therapy also based on classical conditioning. However, this form of therapy is based on the idea that certain stimuli are so pleasant to individuals that the only way to break the bond between the stimulus and the response is to interject something noxious or unpleasant. So let's say an individual has an addiction to nicotine, and this is a nicotine through smoking. So in an aversion therapy model, each time the person reaches for a cigarette, he or she would receive a shock. It's based on the idea that in between the stimulus and the response, there is a very strong bond. And the only way to break that bond is by pairing something very unpleasant with the stimulus. That would be aversion therapy.